Hello, my name is Wesley Gowers. I'm a nurse practitioner student at Auburn University, and this is my initial head-to-toe video assessment. Now, this is my patient, Amanda. Normally she'd be in a gown, but for modesty purposes, she's just in normal clothing. And normally also I would check the eyes and ears bilaterally, but for purposes of video, I'm going to check eyes and ears unilaterally. Now, before I began this video, I washed my hands. I checked her vital signs, her height and her weight. Vitals and height were within normal limits, and her weight was found to be in a BMI of obesity. I will begin with the head. I'm checking for hair distribution. I'm looking at the condition of her skin. I'm checking for any lesions or masses, which which are not noted, which is a normal finding. I'm now going to palpate her head, checking for tenderness and masses. Masses are absent. Does that hurt?
No.
No tenderness noted. Now I will palpate her sinuses. This is the maxillary. Any tenderness?
No.
No swelling noted. Any tenderness?
No.
No swelling noted. Now I will check her temporomandibular joint and cranial nerve 5. So go ahead and open. No crepitus or clicks noted. Clench down for me. All right, cranial nerve 5 is intact. Now I'll go ahead and check the eyes. I'm checking her eyelashes, her eyelids, her eyes, which are symmetrical. Her pupils are 3 millimeters, which is within normal limits. Conjunctiva is pink and moist. The sclera is white. The iris and the conjunctiva are also within normal limits. The lacrimal duct is patent, which is within normal limits. I will now perform an eye exam using an ophthalmoscope, in which I'll be looking for the red light reflex, her optic disc, all the vessels in the eye, as well as the macula. Okay. Red light reflex is present. Optic disc within normal limits, as well as there are no narrowing of arteries or hemorrhaging going on. All right. While I'm at the eyes, I'm going to go ahead and check cranial nerve 2 and 3 by checking for pupil light reactivity and accommodation, and then I will check 3, 4, and 6. I perform the 6 cardinal filter gaze. Okay. All right. Pupils are reactive to light. Or I also check cranial nerve 2. Look straight ahead and follow my pin. Her eyes did cross, which is a normal finding. Okay. Now I want you to follow the pin with your eyes only. Do not move your head. Good job. Good job. Good job. Good job. Good job. Good job. All right. She was able to follow all movements of the pin. That is a finding within normal limits. Okay. Now I'm going to move to the ears. I'm going to check for any kind of tenderness, masses, or any noticeable lesions, which are absent. Does your ear hurt? No. All right, now I'll perform an exam of the ear canal, checking for patency, any wax buildup, or any abnormalities. I'm using a otoscope. All right, the ear canal is patent. The tympanic membrane is pearly and white. I did see a cone of light as well as part of the malleus bone, which is all abnormal findings. Now, while I'm at the ears, I'm going to go ahead and check cranial nerve 8. I will begin by doing a Weber test. Okay, I'm going to hit this tuning fork. I'm going to place on your forehead, and you tell me if you hear it on both sides or one side more than the other. Okay?
Both sides equally.
All right, good. I'll now perform a Weber test. All right. Air conduction is longer than bone conduction, which is a normal finding. I'll now perform a whisper test.
1, 2, 3, 4.
All right, she was able to hear. Now that cranial nerve 8 is intact, that is a normal finding. All right, now I'm going to move to her nose. So first I'm going to inspect the nose. Looks like the septum is midline, nose looks symmetrical. I'm now going to inspect the nares and the nasal turbinates. They are midline. Septum is pink and moist. The nasal turbinates are pink and moist. Septum is midline. I apologize. Okay, while I'm on the nose, I want to go ahead and check the cranial nerve 1. All right, you close your eyes and tell me what you smell.
Cinnamon.
Cranial nerve 1 intact. All right. That completes the nose. Now we will move to the mouth. Lips are pink and moist without cracking or lesion. Your mouth for me, please. All right, tongue pink and moist, back of mouth pink and moist, top roof of mouth is pink and moist, the throat is pink and moist. Looks like the teeth are intact. There are some fillings, but absence of cavities. All right, while I'm at the mouth, I'm going to go ahead and get to check cranial nerve 9 with the uvula. Say ah.
Ah.
All right, cranial nerve 9 is intact. Okay, gums are pink and moist as well. Okay, we're going to go ahead and check cranial nerve 7. I need you to clench your eyes. All right, raise your eyebrows. All right, smile, frown, puff your cheeks. All right, cranial nerve 7 is intact. All right, I'll go ahead and check cranial nerve 10, which is gag reflex. Okay. All right, cranial nerve 10 is intact.
Mm-hmm.
Okay?
Mm-hmm.
All right. Yes, my patient is pregnant. I apologize. Okay?
Mm-hmm. No, I'm fine.
All right.
I'm fine. Yeah.
Okay?
Mm-hmm.
Go ahead and check cranial nerve. I'll go ahead and check cranial nerve 12. I want you to stick your tongue out. Okay? Go up, down, side to side. All right. Cranial nerve 12 is intact. Okay. I need to go ahead and get you some water for throat. Yeah, you can go ahead. Yeah, go ahead and get you a sip of water. Okay, so now I'll go ahead and move to the neck. I'm inspecting the skin for any lesions or masses, which are not noted. That is a normal finding. I will now palpate the neck, checking for any masses or tenderness. Does that hurt?
No.
All right, good. Okay, I'm going to palpate the carotid artery. All right, 2+ in pounding, which is a normal finding. Excuse me. Trachea is midline. Okay. While I'm here, I'm going to go ahead and palpate or auscultate, the carotid arteries. Just breathe normal. Okay. Okay, I'm going to go ahead and auscultate her temporal arteries as well. All right, 2 plus and bounding, which are all normal findings. Okay, I'm going to go ahead and check your thyroid. So I'm going to get you to take a sip of water. I can get one over here. Place in everything there. Okay. All right. All right. No enlargement of the thyroid noted, which is a normal finding. Okay. Now, while I'm on the neck, I'm going to go ahead and check for cranial nerve 11. I'll get you to shrug your shoulders. Okay. And then try and move your head against resistance. Over your right shoulder.
I need to turn this way.
Yes. Okay. Cranial nerve 11 is intact. Now, while I'm on the neck, I'll go ahead and check her lymph nodes. We have her preauricular, postauricular, occipital, parotid, right, tonsillar, okay, submandibular, submental, anterior cervical chain, posterior cervical chain, and supraclavicular. All right. I did not feel or palpate any lymph nodes, which is a normal finding. All right. If I could get you to go ahead and stand up. Thank you. Now, part of our eye exam, we're also going to check peripheral vision. So while she's standing, I will do so. You cover your left eye, I'll cover my right. You tell me when you see my hand come into your field of view, okay?
I see it.
Okay.
I see it all the way up to there.
Okay, you see me? Okay, all right. Now cover your right eye and my left eye. Okay, tell me when you see it.
I see it.
Okay. All right. Okay, all those are within normal fun. Peripheral vision intact. Okay. Now I'm going to get you to lay down, please. Out of the way. All right, so let me grab my stethoscope. Please turn your head over your right shoulder. All right, as I have her lay down, I can see her jugular vein. It is slightly is present and slightly bulging, which is a normal finding. All right, now I'm going to go ahead and begin my cardiovascular assessment portion of this video. Now, normally she'd be in a gown, and I would go ahead and I would palpate her chest, checking for any thrills or palpitations, any heaves, as well as palpate the PMI. However, for modesty purposes, I'm not going to do that. But I am going to go ahead and auscultate her cardiac sounds. Atrial, pulmonic, okay, Erb's point, all right, tricuspid would be here, she lifts her breast, okay, and then mitral. Those are all 2+ and regular. Okay. Now, I'm going to begin my abdominal portion of this assessment. Okay. All right, so first off, I'm going to go ahead and check her skin for any lesions or masses. I'm going to check and see her belly button is midline and symmetrical, which it is. And then I'm going to go ahead and check the condition of her skin, which is intact. All right. The next thing I want to do is go ahead and listen to her bowel sounds. Okay. Okay, which are all normal, normal active. Apologize. Okay, I'll percuss the abdominal quadrants. Okay. All right. Okay. Within normal limits. Now, normally right here I would percuss her liver, but I'm not gonna, for modesty purposes, I'm not gonna ask her to remove any clothing. So I would percuss and then measure, and I would be looking for a normal length around 7 to 8 centimeters. Okay, next part of my exam, I'm gonna go ahead and I can really look down. I'm gonna go ahead and palpate her abdomen. Lightly first. All right, does that hurt?
No.
Okay, no mass is present. Now I'll go a little deeper. Does that hurt? Mm-hmm. All right, my patient is pregnant, so I'm being cautious. Okay. All right. I apologize. Okay, well, no mass is noted and slight tenderness in the left lower quadrant.
It's for the babies.
Yes, I understand. Okay, I'm going to go ahead, though, and try and percuss the liver, the aorta, and the kidney. Okay, all right. Good job. All right, good. And now I'll go ahead and auscultate the aorta, the renal artery, and the iliac. All right. One thing I missed on my cardiovascular assessment, I'm going to go ahead and palpate her pulses.
Do you want me to just read your order for Spartan cardiovascular?
I'm going to go ahead and palpate her pulses. Radial, brachial. Okay. Femoral. Posterior tibial. Popliteal. You can take your shoes off. And pedal, all 2+ and bounding, which are normal findings. You can stand up. All right, I'm now going to check for CVA tenderness. All right, we go to where the 12th rib intersects at the back. Raise her bra. Did you feel any tenderness?
No.
All right, tenderness absent, which is a normal finding. All right, one cranial nerve assessment that I forgot to assess is I'm going to check sensitivity on her skin. So I'm going to put something on your face, an area of your face, and you're going to tell me whether it's dull or it's sharp.
Okay. Dull. Dull. Dull.
Okay.
Sharp. Sharp. Sharp.
All right, now I'm going to touch your face, and you tell me which area of your face I'm touching.
Chin. Forehead. Left cheek. Right cheek.
All right, cranial nerve is intact. This completes my initial head to toe assessment video. Thank you for watching.